Let's now go step by step and build a practical scanning routine that helps you detect these patterns reliably in your daily clinical work. Let's begin with the geometry. The subscapularis tendon, when visualized in the transverse plane, shows a bird beak or triangular shape as it inserts into the lesser tubercle. Even when the internal echotexture is obscured, due to superficial fat attenuation or anisotropy, you can still appreciate its outer contour. It's crucial to estimate the thickness of the subscapularis tendon, specifically at the true tendinous portion, which typically measures around 5 millimeters. However, rather than relying solely on this absolute value, I strongly recommend comparing it to the supraspinatus tendon and the rotator cuff interval, using a perpendicular scan aligned along the transitional course of the biceps tendon and the supraspinatus. If the subscapularis appears significantly thinner, it often indicates chronic tendon loss, a finding commonly associated with massive rotator cuff tears. On the other hand, a hypertrophied subscapularis tendon suggests chronic internal tearing or disorganized tendon fibers due to subcoracoid impingement.